We really want to find a way to cure all cancer, but the reality is the best way to get rid of cancer is to prevent it in the first place. Colon cancer is unique because we know that it starts as a polyp. We can find a polyp with colonoscopy, so if we can get rid of the polyp before it's a cancer, we cure this disease, and we can do that 90% of the time if people just follow the screening guidelines. Many people don't realize that colon cancer is the second leading cause of cancer death. It doesn't affect women more than men. It doesn't affect you more if you're black or white. In fact, the only thing that determines colon cancer is age, because it mostly happens after age 50, but it is preventable with screening. Colon cancer will occur in 150,000 Americans this year, and 55,000 will lose their lives, 1,400 in Georgia alone. And this is a preventable catastrophe. For every 100 patients who get screened, 10 cancers will be prevented and 3 lives will be saved. We can do much better than we're doing right now. 40,000 lives could be saved with routine colonoscopy. It would be wonderful if all of our healthcare decisions were just made on the basis of what's right for people. But unfortunately, cost is part of that equation. But in colon cancer, we have an opportunity to address what's right for people and what's right for societal cost. The cost of screening is minimal, less than $1,000 per patient. But once we diagnose colon cancer, we're dealing with what could be $250,000, $250,000 of cost. But there's a way to both save lives and save money, and that's by preventing this disease. The colon cancer prevention story is an easy one. It's not rocket science, it's straightforward. If you are African American, you begin your screening at age 45, and if you're not, you can start screening at age 50. If the doctor finds no polyps, the screening repeats every 10 years. If they find a polyp, they remove it when it's a polyp and not cancer, and you get screened more frequently. If you've got a family history, start your screening 10 years younger than the age of your family member. This isn't hard stuff to do. It's the right thing to do. It's right for you. It's right for your spouse, for your kids, and for your family and friends. Do the right thing. Get screened. Now, you hear about lots of other procedures to screen for colon cancer, like testing the stool, a barium enema, virtual colonoscopy, but they're just not as good. Only with the colonoscopy can you directly visualize the entire colon, can you remove the polyps that are found, and can you be sure that you've seen everything that needs to be seen. Unfortunately, our system's kind of broken. People don't get colonoscopies because they have misconceptions about the procedure. They have copays, they have deductibles, they lose a day of work. We've got to do a better job. We've got to find ways to align the incentives so people do the right thing. Insurers have got to give up on the copays and deductibles when people do the right thing. Employers need to be smart as well. They need to not penalize the patients for doing the right thing. That'll in the long run save them money as well because people stay at work. Doctors have to participate too. We've got to improve access. If we all do the right thing, this is a disease that can be prevented, and 40,000 lives every year can be saved. Georgia may be uniquely positioned to be a leader in colon cancer prevention. Through the efforts of the Georgia Cancer Coalition, there is the opportunity within 4 years, a single gubernatorial term, to cut in half the rate of colon cancer deaths and diagnoses in this state. As a Georgian and as a cancer specialist, I implore all the stakeholders in this problem to step up and try to make a difference for the lives of the people of Georgia and for all the costs that's being wasted by caring for a disease that we could be preventing.